so much for sharing your story with us today. You really tell us why we're doing what we're doing here and how important what we're talking about here today is. And thank you for reminding us of that. Fortunately, there is a solution in Ohio and for Ohio's kids. Ohio lawmakers can fund a comprehensive tobacco prevention and cessation program by either taxing all tobacco at the same rate, so that the other tobacco products tax that covers non-cigarette forms of tobacco is the same rate as the cigarette tax, or they can dedicate just 5% of the current cigarette tax to tobacco prevention and cessation. But will these types of policies work in Ohio? Yes, they will. This graph shows the Ohio quitline collars from 2003 to 2011. This graph clearly shows that public policy interventions recommended by the CDC and highlighted in our report encouraged Ohio smokers to make quit attempts. As you can see, both the state and federal cigarette tax increase caused a large spike in the number of people in Ohio who called to receive help in quitting. The passage of the Smoke-Free Ohio law also encouraged Ohio smokers to quit. Media campaigns, both earned media and a small paid media campaign, were also effective. You can see also how effective a well-funded tobacco prevention program was. That's the large jump all the way across there. You can see the calls in the spring of 2008 dipped. That happened when the Ohio Tobacco Prevention Foundation was abolished and funding and programs were severely decreased. The graph shows that Ohioans are responsive to tobacco prevention and cessation programs that our state lawmakers can easily implement. Since I've addressed many of you on the state of tobacco control in Ohio last year, I've had a sad thing happen in my life too. My neighbor, Tim Clark was his name, died of throat cancer. Tim started when he was a teenager. It was the thing to do, and most of his friends smoked. Didn't seem like it was going to kill him. And if it did, he would be too old to matter then. That's what you feel like when you're a teenager and you start smoking. You have to die of something, right? That's what he thought. When he was first diagnosed with throat cancer, he went through treatment. They thought they got it all. He kept smoking. Couldn't quite quit, and it came back, and he quit. But it was too late then. And you've probably heard the phrase, a long and painful death. That's what Tim's death was. It was a horrible thing to watch. Something no one should have to live through. So here I am again, another year. And unfortunately, I can't say that the state has made many strides in preventing situations like what has happened to my neighbor Tim, or what happened to Lily's dad. But I'm here on behalf of him. I'm here on behalf of Lily's dad, and Lily is too, though it's very hard for her to talk about. She's here too. And there's a bunch of people here in the room too. And I'm going to continue to be here until something is done to prevent this from happening again, until the state of Ohio steps up to help the kids of Ohio today who are just trying to decide, just like Tim did, just like Lily's dad did, whether to accept that cigarette from a friend. All of us here gathered here today are committed to finding solutions so that we can give smokers the help they need to quit, so they can live the long, healthy lives that Tim and Lily's dad saw cut short. We call on Governor Kasich and the state legislature to join us in saving lives and saving money. We'd be glad to take any questions.
Shelly, you and other anti-tobacco activists have been pushing for this tax increase for years. It's pretty much fallen on deaf ears. Why would this year be any different?
We feel like we have talked to our lawmakers. We know that in the past we have not had success, but we've gotten indications that in this mid-budget review they may be open to the idea of that. Either doing that or potentially giving us a percentage of the cigarette tax if they're not open to a tax increase. Also, Kasich has recently raised a tax on shale and oil gas revenues, so he's shown that he can be open to taxes now. So that gave us a bit of encouragement.
Philip Morris has also been lobbying for a change to ad valorem tax. I don't remember the details, but it would also basically be a tax increase. Essentially, it benefits them because it would increase taxes on the cheaper products. something you would support?
I think you're talking maybe about the weight-based tax.
Yeah.
Yeah. No, we wouldn't, because the way they do the tax is that it is an increase, supposedly, but what it does is it makes the most used brands, which are the ones that kids use most frequently, because kids use brand names like Copenhagen and things that Philip Morris sells, actually cheaper. So the most popular brands would be cheaper, and it would actually increase use. And over time, because it's based on weight instead of percentage of the wholesale price, the tax would be reduced. It would lose value over time. The state would get less revenue. The tax would be worth less, and more people would end up using tobacco over time.
Shelley, you brought up, I think the fact that every Ohio family pays $614 in taxes because of the event of the health changes that tobacco causes. So by raising the taxes on cigarettes, Kasich would actually be lowering the overall tax burden in Ohio.
Yes, it definitely would, by raising our tax, save money in the long run, definitely, for every taxpayer, every business, and save Medicaid costs. Since, as I said, 42% of our Medicaid population is smokers, so.
And in fact,